Hi, I'm Zachary Strickland. I chose to do my persuasive speech on universal health care. The reason I chose this topic is because it's kind of a hot button issue right now, especially with its success in nations like Canada. Here in the U.S., we have what's called a two-tier healthcare system, in which they are required to treat you if you come in, but there's also the private system as well as the public system. Private system caters more towards people with big insurance, like expensive insurance, and it's more for the wealthy and not for the poor. The poor people, they're gonna go and get the care that they basically need and get sent home. These private systems, people come in and they're catered to. There are a lot of advantages to universal healthcare. Mostly, the first and foremost one would be accessibility of healthcare by all individuals. That would be an awesome fact if everyone could just go get the same healthcare, the same rate, the no more expensive, more this healthcare is better. Everyone gets the same healthcare, same price, all in one. Um, there's a with universal healthcare, there would also become a reduction in poverty and debts, and also bankruptcy due to caring for sick loved ones. If a sick loved one's sick and in the hospital with cancer for 2 years, that could add up to a family losing their home, their car, or possibly even being out on the street just due to caring for a sick loved one. The universal healthcare system would also create a reduction in illnesses, which would increase the productivity of society's workers. Because if society's workers are more healthy and feel better and are happier, then they're more likely to work better and more efficiently. Doctors would be forced more to focus on patients instead of on insurance information or insurance paperwork. Whenever a patient comes in, the first question is not going to be, do you have your insurance card? It's going to be, what's wrong with you and how can I help? Which would lead to make people feel more equal and feel better about going to the hospital and getting health care. Right now, currently in the U.S. with this two-tiered system, there's a lot of, it seems, oppression of cures to very, very detrimental diseases due to the benefits that the pharmaceutical companies reap by selling these supposed cures. They're not really cures. They're just there to keep the symptoms down until the disease eventually kills the person. Like HIV, cancer, we have all these supposed cures and treatments, as they call them, that help people to try to feel better, and in some cases do heal people. But in reality, there probably could be a real cure where cancer would no longer be an issue. But these pharmaceutical companies are oppressing all of this research due to the big profits that they're gaining by selling these cancer treatments, these HIV treatments. So all in all, it seems that if we were to go with a universal healthcare system, it would lead to a more knowledgeable healthcare system, although it may not be as catered towards the wealthy as is our two-tiered system today with the private sector. All in all, I feel for everyone it would be more beneficial. With a universal healthcare system, there comes a lot of business implications. Um, it would create a more centralized job system for healthcare professionals. Basically, meaning that since it's covered by the federal government, the jobs are more secure, and there's not going to be much like hospitals closing, new ones opening. It's going to stay more consistent. Also, for small businesses, there's been a study that showed that in nations with universal health care, there's a lot more small business employment and small startups going on, and that's where most of their economy is in small businesses. And in America, our small businesses are not as they are in other nations. This could possibly be due to the high cost of being self-employed and not with it not coming with a healthcare package. And also with these small businesses, when they're trying to find employees, if they can't offer a healthcare package, it's kind of a deal breaker for some employees because they want that job security and that the ability to be able to go to the hospital and be seen when they need to and not have to pay out of pocket an outrageous amount of money just to go to the ER. Average ER visits are usually around $3,000. Someone working in a small business making 1,500 every 2 weeks is not going to be able to afford that. Um, Another thing would be businesses would not need to offer healthcare plans due to this universal healthcare plan. Even larger businesses, larger firms, they wouldn't have to offer these big expensive healthcare packages and deal with these insurance companies. And not being able to deal with the insurance companies would make the businesses be able to focus more on business and not on offering these packages and paying for all of this stuff that should be a basic human right. It wouldn't be right or fair to talk about universal health care without discussing the monetary implications of enacting such a large system into our society. But optimally, the way we would pay for this system would be to increase taxes, which everybody know they don't want taxes increased. But if you think about it in the long run, you could pay this a little bit more in taxes and not have to pay $3,000 whenever you need to go to the ER. If you think about it in the long term versus the short term, it seems to make a lot more sense. The other possible way that we could pay for this universal healthcare system would be through payroll and Social Security contributions, like we do with welfare and Medicare, Medicaid currently. And if you think about it, there would be no need for insurance premiums or deductibles or any of those such things whenever with this universal healthcare system. And drug costs for people that take insulin daily, diabetics, they would be reduced greatly, and this would be able to help these people to lead a lot happier, healthier, and have more money to spend, which goes back to the economy if they don't have to spend it on insulin. Yeah, it's coming out of taxes, but it's still going back into the economy. Also, with this universal healthcare system, there'd be investment in community welfare systems. And these community welfare systems are basically they're preventative measures. They help teach people how to stay safe, like from diseases, how to wash your hands, what's healthy, what to eat, what you should eat, what you shouldn't eat, telling kids that junk food is bad, that sort of thing. All in all, I feel that having a universal healthcare system could benefit our nation greatly. It would allow us to get away from this oppression of knowledge from the medical-based fields and start us to be more innovative in finding cures for these diseases and helping our society as a whole instead of just trying to make a profit from it.